Hi, so this is the gentamicin sulfate solution that I got from our vet. It's got 10 milligrams of gentamicin per 1 milligram of water. That is, I believe, a 1% solution approximately. She compounded it, I'm sure, with some kind of sterile solution for injection plus saline to dilute it. You could probably make it yourself if you happen to get some. So what I do is every time I nebulize, if I have any extra, I put it in a separate little bottle to avoid contaminating the main bottle. And then I use this up and then I add some from the main bottle, to make the sufficient amount. So here's the nebulizer cup. Okay. You see it's got two parts. This is the top here, and this is the connector piece to the oxygen tent. And you can see the rats are already in there in their cage. If you're going to nebulize something like a guinea pig or a calm little animal like that, they have, sometimes they make a nebulizer thing that is a much smaller, container, and it's got a little hole in it for the nebulizer thing. But because these are roof rats, it's just better to put them in a cage first, and then put the cage in the oxygen tent like that, because otherwise they're going to run out and stuff. It's a real pain. So anyway, I just put these two pieces together. Okay, and then as I told you, I've still got the leftover solution from the last time, so I'll put that in there, and we'll see how much we have. And that's just a few drops, it's not enough. So I want to have I want to have enough for 10 minutes, so something like up to there or something from experience. I know that. So I'm going to have to add some more to fill it up. So, okay, I just pour in my solution and kind of eyeball it. That looks like it's enough to me. All right. Now you want to keep this gentamicin refrigerated. So as soon as I start this, I'm going to go ahead and put that or the rest of that bottle in the refrigerator and wash the little bottle, because really you don't want it to get contaminated. So reusing the liquid once or twice is okay, but you don't want to keep doing it. Okay, so I'll just go ahead and plug this in. Okay, turn it on. We want to do 10 minutes. So my nebulizer has a timer, so I set it to 10 minutes, and there they go. And I mean, they don't love this, but it's not horrible for them. It doesn't seem to cause them any coughing or discomfort. They don't like being in there, but it's not hurting them. And the gentamicin really seems to help against Mycoplasma. It's not an antibiotic that is commonly used for rats or other animals, because it does have toxicity to the kidneys and hearing, and it's generally not good for you to take it if you don't have to. But if you nebulize it, then most of the dose goes directly to their lungs, where the mycoplasma is, so to their respiratory system, rather than the rest of their bodies, like their kidneys, their ears, and nervous system and stuff like that, where it could harm them. So this is a very good drug to take nebulized, because the level of drug is going to be very high, directly where it needs to go to kill the germs that are infecting them. But it won't be high in the rest of their body where it might harm them. Since their infection is confined to their respiratory system, and the nebulized drug goes directly to their respiratory system, this is the best modality of treatment for these guys. And I found after nebulizing for a week even, it is really remarkable. They have pretty much, would you say, Chong? They're not symptomatic. So we're probably going to test them to see what their LDH and stuff. LDH is a marker of cell damage. So when they have an active mycoplasma infection in their lungs, their LDH will be elevated. So if we do a blood test, we can actually tell if this stuff is actually working and getting their infection under control, which I believe it is, just by observing them. Okay, I hope that was helpful. Now, what we're going to do, just to be sure that they don't develop resistance to the gentamicin, we also give them Baytril. So Baytril is actually synergistic with gentamicin. You can give them both at the same time. You can even nebulize Baytril. It's not, it's one of the ways you could deliver the drug. So if you give them both gentamicin and Baytril at the same time, then that will help prevent the bacteria from developing resistance, and it will be more effective at killing the bacteria. So anyway, ask your vet. I'm not a vet. I'm just giving you advice here, but this is not, don't consider it to be medical advice. We got this from a vet. You should ask your vet too. If your vet thinks this is a good thing to do, then you should try it. Okay? And again, our goal is to help them, and I hope this helps you help them. Okay, that's all for now. Thanks.